Hey there, back again for another video to catch you up on my 2-week follow-up after part 2 of my surgery towards Jpouch creation. And today is Sunday, February 3rd. Tomorrow will actually be 3 weeks since my surgery on January 14th, which was the second part of my 3-part Jpouch creation surgery. So I went in last Tuesday for my 2-week follow-up. I saw my ostomy nurse as well as my surgeon's nurse. And the ostomy nurse came in first. And she took off the bag. Still looked, I had mentioned in my last video, like maybe there was a little bit of folliculitis or a little bit of a yeast infection around that area, so she had me start to use this powder called Nystat, which she had called in a prescription for back the first time, and it cleared everything up in 1 or 2 bag changes. So she put some of that around there. And then she also took out the tubing that was around my intestine that was used to hold my intestine out for the first 2 weeks while the sutures healed. Because, as I had mentioned before, because this stoma is a loop ileostomy, it's farther up in my small intestine, it doesn't necessarily protrude as well or as nicely out of the abdomen as my last one did. So they use this rubber tubing around the intestine to keep it out of the abdomen for the first 2 weeks, and then they take that the tubing out. The tubing was kind of a pain in the butt for the first 2 weeks to change the bag because it was pretty round, so you had to kind of squeeze it to get it inside the hole in the flange to get the bag in. And if the bag got too tight, like if you squeeze the air out of the bag, then when the bag moved, the tube would move, and sometimes it would cause a little bit of bleeding. So it was good to get it out. So there were just 2 sutures she had to snip off, and then took the tubing out, which was very nice. And actually, my stoma, at least as of now, seems to be in really good alignment. It protrudes just a little bit out of the abdomen, which is good, which means she said I could probably go back to using the same kind of bags and flange system that I was using before this surgery, at least for now. And also what we noticed is that the hole in my small intestine where the output actually comes out, now that most of the swelling has gone down, the hole is actually pretty well centered right in the middle of everything, which will help a lot with hopefully not having leaks. Sometimes if that hole is down towards the edge of the sutures or the incision on your abdomen, sometimes you can have some leakage issues. So hopefully things are going to go well with that. I just ordered some more ostomy supplies and used the same bag system that I had used last time. So that seemed to go really well. And then my surgeon's nurse came in, and I had mentioned way back in my first video, I think, or second video, this nurse that I saw, the surgeon's nurse, she's actually an advanced practice nurse, nurse practitioner. I'll actually be with her basically for life. I'll be following up with her, or as long as I'm in this area, the Chicago area. She follows all of the surgeon's patients, Dr. Hurst. She follows all of the patients that have a Jpouch, which will be me. So I'll be with her, like I said, for indefinitely, which is good because I really like her. So she came in and took all the staples out. I had 18 staples, I counted them. Taking the staples out wasn't too bad. They pulled a little bit each time, only because the incision had started to heal. But it wasn't awful. But it was nice to get those staples out. And I asked her about my incision, because the incision seems to come down and curve a little bit. And you don't notice as much when I'm lying down, and I didn't realize that, because in the office when I was laying down and she looked at it, she goes, "It doesn't look crooked." And I was like, "Oh, I guess it doesn't," but didn't realize until later that once I stand is when it seems to look a little crooked. Not that it's a big deal, especially once the hair comes in and the incision starts to kind of become less noticeable. But I just wondered if perhaps the surgeon had to kind of go around something or was concerned with the way he was cutting or whatever. And basically she just went through everything we've already talked about, keeping with the Imodium if I need it, it's as needed. If I'm having trouble staying hydrated or my output is too liquidy, the goal again is to have your output be on the thicker side at least 80% of the time that you empty it per day. So that's kind of the goal. She also asked me about bladder function, which is good, and sexual function, which was good. The funny thing was my mom happened to be in the room during my follow-up, and the nurse was asking me as far as, sorry for all you friends and family that are watching, but it's, you know, it is what it is. So the nurse asked me about the ability to get an erection and as far as semen production, and I was like, yes, good on both counts. And then realized my mom was there, and then kind of didn't think too much about it until later when my mom was home, and she said, yeah, that seemed to be a little bit too much information for me at the time. So that was kind of a little funny. But like I said, it's important. They want to know as soon as they can if there's any issues with your bladder or sexual function, because they want to address it right away. So I told her that things were good. She said there's some healing going on because I still have, again with the urination, I can't really describe the feeling. It's not pain. It's just a tingling, I guess, is what I would say. Sometimes when I have to pee, or when I feel like the bladder gets full. And then also I've noticed sometimes when I contract the sphincter muscle in the anal area, it almost feels bruised, and I know, you know, they had done surgery and stuff in there, so I'm assuming it's related to that. It keeps getting less and less. And I also notice, like, if I'm feeling a buildup of mucus, like I need to go to the bathroom, sometimes that bruised feeling gets a little bit more intense, and that kind of lets me know that I need to go and sit on the toilet real quick, just for a short time. But no leakage or anything like that. I mean, I'm not having trouble controlling the muscle or anything like that. But I wanted to be honest and upfront about that. I wanted to clarify something a couple of videos back. I think it was from my pre-op before the second one. The surgeon's nurse had told me that sometimes I talked about a group that used the hand sew technique, where the surgeon hand sews the small intestine into the anal canal, versus another group where they staple. And she said sometimes the group that is hand sewn can take some time and may have more little kind of nighttime wetness or leakage issues. And I think in that video I had said after 9 weeks the hand sewn group catches up to the stapled group. But I clarified that with the nurse this last time. It's actually at 9 months after the final surgery. So what she's talking about is in April, when I go for my third surgery, where they take the ostomy down and they basically open up the plumbing, the new plumbing. From that point up to 9 months, I may have some issues with nighttime dampness or wetness, not like I was talking about in the last video where I had a ton of drainage right after surgery. But just a little bit, and she said up to 9 months you can have that, and then at 9 months the group that had the hand sewing catches up to the group that was stapled, in that there's no more leakage or no more issues of dampness. And she said not everybody has it, but it's just something to be aware of and to look out for. So right now I think that's it. The nurse changed the bag on Tuesday, and I've changed it once more since. The ostomy is looking better, the skin's looking better. There are some dissolvable stitches around the ostomy where they sew the intestine back to the abdominal wall, the skin area, and those dissolve over time. So those sometimes can be a little irritated, but they seem to be doing well. I actually took a picture of the stoma, and I'm going to send it to my ostomy nurse tomorrow for her to look at when I change the bag. My third surgery is scheduled for April 8th. So after tomorrow I'll have 9 more weeks, so 2 months and 1 week with a bag. And I'll have another pre-op appointment before that surgery. And at that pre-op appointment, what they'll actually do is what's called a digital proctography. I think I have that name right. Where you go down into the radiology department and they use a barium enema basically to shoot a small amount of dye up inside the J-pouch. And they take pictures and then they have you bear down like you're having a bowel movement, and then they take pictures, and then I think they take pictures after that to see how well it emptied. And basically they're just checking to make sure that the J-pouch is what I call sealed and healed. That there's no leakage anywhere, that things are working as they should. And then they may check at that point too to see if there's been a stricture, or if after the surgery I talked about in a couple of the other videos, sometimes the sphincter muscles can become very tight to where they need to be dilated. Usually the nurse said that they could do it just with the finger, just to stretch the tissues, which sounds uncomfortable, and I'm sure it is. Occasionally she said if a digital stimulation or dilation doesn't work, they have to take you, I don't think they have to put you out, but they might do it under some anesthetic and use a special device to dilate the tissues more. But I'll know more of that, like I said, at that pre-op appointment in April. So I think that's about it for now. I expect things to just go along as they were before. Eventually I'll be back to wearing the stealth belt, back to work. I go back to work in 3 weeks. Time seems to be flying right now, even though it's winter time, and I went out for a walk today and it's freezing cold out. So not too much time to get out there, but I'll have the same kind of bag system, so I don't expect any issues related to that. The biggest thing is going to be the hydration. I think I've noticed that my food does tend to move through me a little bit quicker. Last time, I think I noticed about 3.5, 4 hours things seem to go through me. Now it seems like it's about 2. So I am taking a multivitamin, a gummy multivitamin, because it'll dissolve easier, which I cleared with my nurse. And I'm just eating a lot of frequent meals, so I'm not sure exactly how this time it's going to work out when I go back to work, because working in the hospital, it's not easy every hour, hour and a half to stop and have a decent size meal. I can grab a couple crackers with water, but so I'll probably work that out, but not sure if I'll be making any more videos between now and my next pre-op, unless something significant happens that I find might be helpful to somebody out there. So for now, I think that is about it. As always, if you have questions or comments, you can use my email at ucandpsc@gmail.com. Check you next time. Oh, sorry, one more thing. I wanted to show you what the incision looks like now since the staples have been removed. I forgot about that. So let me show you that. And I do have a bag you cannot see through on, so for those of you who don't want to see what's in the bag, you don't have to worry. So there we go. And see, you can see when I'm standing, the incision looks a little bit curved. I'm kind of picking the bag off to the side, and then it looks straight. And I think it could be because this area is swollen here, but there's the incision, there's my belly button coming down. So it comes pretty low. I normally would wear my pants probably about here. And then you can see, these are the laparoscopic incisions. They look like large freckles now, but that's it. So I'm hoping that this nice looking gnarly incision ends up healing pretty bad. It's kind of numb through here, and you can see part of the bag, the adhesive, fits over part of the area where the stitches were, or the staples, but it's not sore, so that's not a big deal at all. But I wanted you to be able to get a look at what the incision looks like now. So not too bad, maybe, I don't know, maybe 4 or 5 inches, but not bad at all. And like I said, back to the regular bag system that I've been using. So that is it. So I will check you next time. Take care.